All right. So relationships between joint shape and the development of osteoarthritis. Purpose of review: to present an updated summary of the relationship between joint shape and the development of osteoarthritis, with a particular focus on osteoarthritis of the hip. Recent findings: osteoarthritis of the hip is highly heritable with a genetic contribution estimated at 60%. Among the genes that have been linked to this disease are several that are involved in the development and maintenance of joint shape, including members of the wingless and the bone morphogenic protein family. Several features of hip joint architecture, such as the acetabular dysplasia, pistol grip deformity, wide femoral neck, altered femoral neck shaft angle, appear to play an important role in the pathogenesis of osteoarthritis and may predate the development of osteoarthritis by decades. Summary: gene development interactions play a crucial role in the development of osteoarthritis. The architecture of joint shape is determined by a complex sequence spanning embryonic, childhood, and adult life and contributes to the pathogenesis of osteoarthritis. Big keywords: bone, geometry, hip, joint shape, and osteoarthritis. All right. And
Wait, are we discussing like in between or we're
I
just
think
reading
that
the whole
I thought
thing? Okay.
that's kind of what I was saying. Like I was thinking, like the big thing was that we all read it beforehand, and then we could discuss it as we go. I think it would be more natural, but I mean, I don't know. Maybe we could just discuss it as we read here.
Yeah, we can do that.
What's that?
I was just saying we could do that. I think after each section, that might just be easiest.
All right. I'll just keep going then for now. So, introduction. Osteoarthritis, the most common form of arthritis, is characterized by the degeneration of cartilage and subchondral bone. Osteoarthritis is a frequent case of morbidity among the elderly, and its prevalence is expected to increase even further in the coming decades. Due to the enormous public health impact of this disease, significant effort has been directed towards the identification of risk factors for osteoarthritis, although it was hypothesized as early as the 1960s that joint shape is a key predictor of osteoarthritis. This idea has recently begun to be further explored. Early paradigms of osteoarthritis pathogenesis asserted that most osteoarthritis was so-called primary or idiopathic, resulting from chronic mechanical damage due to structurally normal joint joints. Later, however, it was appreciated that the secondary osteoarthritis or osteoarthritis resulting from an identifiable predisposing factor is much more common. Among secondary factors involved in the pathogenesis of osteoarthritis, the architecture of the joint itself is a key feature that may promote or protect from osteoarthritis. It is known that subtle structural features of bone predate the development of osteoarthritis by decades in the vast majority, perhaps up to 90% of osteoarthritis cases. In this review, we explore the emerging picture of the complex relationship between joint shape and osteoarthritis, focusing on osteoarthritis of the hip as an illustrative example of this relationship. You got anything to say about that, or should I move on?
Yeah, if you can keep going.
Keep going.
Yeah.
All right. Osteoarthritis of the hip is common and highly heritable. Osteoarthritis of the hip is extremely common. In the Rotterdam study, a large Dutch cohort of participants over the age of 55, radiographic hip osteoarthritis was present in 15.9% of women and 14.1% of men. In the US, the prevalence of hip osteoarthritis varies. Among the elderly US Caucasians, a prevalence of 3 to 13% has been reported through in at least one population of Southern Caucasians. A prevalence of over 20% was found. Among African Americans, osteoarthritis of the hip might be slightly more common in the US Caucasians. Interestingly, for reasons that are not fully understood, the disease is relatively rare among Asians and Africans. Osteoarthritis of the hip is defined for epidemiologic purposes by the radiographic combination of definite osteophytes and joint space narrowing. There's relatively poor correlation, however, between radiographic hip osteoarthritis and clinical sequelae such as pain and functional limitation. Across studies, only a minority of patients with mild to moderate radiographic hip osteoarthritis report symptoms of hip pain. For example, in the cross-sectional Rotterdam study of community dwellers aged at least 55 years, hip pain was present in 16.0% of men and 33.2% of women with radiographic hip osteoarthritis. However, with increasing severity of radiographic hip osteoarthritis, association with joint pain increases. For example, in the most severe category of radiographic hip osteoarthritis, hip pain was present in 31.0% of men and 49.1% of women. Among the factors that predict the progression of radiographic hip osteoarthritis, joint shape parameters such as baseline femoral neck width and femoral head migration are important in determining osteoarthritis outcomes. It is noticeable that there is apparently little overlap between architectural features associated with radiographic hip osteoarthritis and those associated with clinical hip osteoarthritis. For example, in a recent study by Warsing and colleagues, using the active shape modeling ASM technique to assess proximal femur shape, femur shapes that predicted hip pain were distinct from femur shapes predicting the presence of radiographic hip osteoarthritis. Move up a little bit. There we go. Human genetic studies have suggested that osteoarthritis of the hip is highly heritable, with a genetic contribution of approximately 60% in women, according to the classic twin studies, after adjustment for known confounders. The genetic contribution to osteoarthritis appears to differ by anatomic site, with osteoarthritis of the hand and hip showing a greater tendency to cluster within families than osteoarthritis of the knee. Genome-wide association studies have identified regions of chromosomes 2, 4, 6, 7, 11, 16, and 19, and the X chromosome as harboring important genes involved in the hereditability of osteoarthritis. At least 5 distinct biological pathways have been implicated in pathogenesis of hip osteoarthritis based on these genetic studies, including inflammatory cytokine, bone morphogenic protein, and the wingless pathways. Right. You also need to write, or you need me to move on? All good? Thumbs up?
I think
Good.
so.
Keep going. All right. Bone morphogenic proteins and the wingless pathway, molecular links between joint shape and osteoarthritis. The wingless pathway has recently gained attention for its role in both determination of joint shape and development of osteoarthritis. During skeletal development, wingless pathway proteins are expressed in the limb bud and at sites of synovial joint formations. Alterations in this pathway lead to limb malformations in animal models. In adult life, wingless pathway signaling continues to play an important role in joint homeostasis. Excessive activation of this pathway is involved in regulating cartilage breaking down and bony sclerosis in osteoarthritis, and single nucleotide polymorphisms wingless pathway proteins are associated with increased susceptibility to osteoarthritis. Antagonists of the wingless pathways are currently in clinical development for treatment of the sclerotic bony lesions of multiple myeloma and osteoporosis through their efficacy has not been tested in osteoarthritis. Another important group of molecules involved in both the pathogenesis of osteoarthritis and the determination of joint shape is the BMP family. BMPs and the closely related growth and differentiation factors comprise a large family of proteins nested within the transforming growth factor superfamily. BMP signals through the SMAD pathway or the mitogen activated proteins kinase pathway to elicit bone and cartilage formation during the development, as well as the cell differentiation and tissue homeostasis in adult life. GDF5 is required for proper digit formation up in vertebrates. Um, yep, there you go. And overexpression of BMP2 and BMP4 dramatically alters joint phenotype in the developing chick limb buds. Polymorphisms of protein in this family that have been associated with hip osteoarthritis includes BMP5 and GDF5. Gene environment interactions in hip osteoarthritis.
Let me take a second. Um, it says I have 5.5 minutes left. Like, I don't know if it's recording or like 5.5 minutes left of.
No, it says I have 5 minutes left as well. Honestly, we're at the 35
Yeah,
minute mark
it's
already, so.
because that's like the free Zoom allowed time. So we'd have to stop it and restart the Zoom.
Okay,
Yeah, but honestly, I feel like we made really good progress. Like we already went through the papers. We went through the first few parts, and not to mention, we're already past the time limit as well. So, how do we feel? How do you feel so far? Do you feel like we know what we're doing? Do you feel like we know what sections we're responsible for and everything like that, or is that something that had to come up?
well, I think she wants us to go through the entirety of the paper,
Hmm.
the
Yeah. So, I
like on the
mean,
Zoom call.
we
Yeah.
can just edit that in. So maybe
Oh,
I can read one more
Yeah,
passage and
like
then we
we can
start.
clip this part and like
Yeah.
yeah.
All right. So I'll continue on. Gene environment interactions in hip osteoarthritis. Animal studies show that skeletal shape is determined by a tightly regulated genetic program during development. In the mature organism, the joint shape is maintained through a dynamic process of homeostasis and repair, and changes in joint shape continue to occur throughout adult life. The dynamic regulation of bone shape makes the analysis of a relationship between bone shape and osteoarthritis complex, as changes in joint shape may both predispose to osteoarthritis and occur as a result of osteoarthritis itself. Several environmental factors have been identified that predispose to hip osteoarthritis. Gelber and colleagues performed a prospective cohort study of 1,321 former medical students with a mean baseline age of 22 years with 36 years of follow-up, and found that a history of hip injury was associated with a relative risk of 3.50 for subsequent hip osteoarthritis. Croft and colleagues performed a cross-sectional study of 250 male patients in rural general practice clinics in the UK and found that the occupation of farming was associated with an odds ratio of 9.3 for development of radiographic hip osteoarthritis. Vingard and colleagues, in a case control study of 233 men with early age onset of severe hip osteoarthritis requiring joint replacement, and 302 controls found that exposure to sports or other activities requiring joint replacement, and 302 controls found exposure to sports or other activities with high mechanical loads substantially increased the odds of hip osteoarthritis. Interestingly, Nevin and colleagues evaluated the effect of estrogen use in a cohort of elderly Caucasian women followed for a median of 8.3 years and found that exogenous estrogen use was associated with a decreased risk of osteoarthritis of the hip. Environmental factors may influence the development of osteoarthritis more or less strongly in particular anatomic contexts. For example, one study found that an interaction between acetabular shape and workload in the development of radiographic hip osteoarthritis. Known associations between hip shape and osteoarthritis. Several specific hip shape variations have been associated with osteoarthritis, as discussed below. Developmental dysplasia of the hip. Developmental dysplasia of the hip is the most common cause of osteoarthritis in young adults. Congenital subluxation, Legg-Calvé-Pertz disease. Oh, what did I say? Oh, Legg-Calvé-Pertz disease and slipped capital femoral epiphysis are developmental abnormalities that have all been linked with hip osteoarthritis in adulthood. Despite this, the presence of DDH is not always concordant with the development of hip osteoarthritis. In the Japanese, for example, DDH is quite common, yet osteoarthritis is rare. Despite this, a history of congenital dislocation of the hip or acetabular dysplasia is usually present in Japanese who do develop osteoarthritis. All right, so we're gonna need to cut this part because we got less than a minute.
I'll send out a new link.
All right.